Hello doctors, now we will see about removable partial dentures, and for that let's see the introduction, diagnosis and treatment planning to removable partial dentures. Now removable prosthodontics, first of all we all know that prosthodontic is classified into two types broadly, into removable and fixed. So in removable prosthodontics, something which is removed, that is removable. All those fixed parts are fixed prosthodontics. Now removable prosthodontics is devoted to replacement of missing teeth and contiguous tissue with a prosthesis designed to be removed by the wearer. This is the art and science of replacing absent body parts is termed as prosthetics, and that artificial part will be termed as prosthesis. An abutment is any tooth that supports or fixed or removable prosthodontics or prosthesis. Extracoronal partial denture. The name itself is saying extracoronal, outside the crown. So the retention of this prosthesis depends on exact parallelism of both the sides of the crown. Hence, the retentive components of the denture do not invade the abutment tooth structure. Whereas tooth supported removable partial denture and tooth tissue supported. The name itself is saying tooth supported removable partial denture. Those dentures which are supported by tooth only. Those dentures which are supported by tooth as well as tissue is called tooth tissue removable partial denture. Like in cases of distal extension. Distal extension means the last area of the mouth. If that doesn't have any tooth to support posteriorly, that particular area will be called distal extension, and that will be tooth tissue supported, because posteriorly it is only tissue, the mucosa which is supporting, and anteriorly we have the tooth which is supporting. We will see different classifications which was come across and which is broadly used in day-to-day terms. Now those are the complete dentures, but those are removable prosthodontic. We have shown the pictures of removable prosthodontics. And this is a removable prosthodontic treatment partial denture. This is called TPD, treatment partial denture. Since it does not have any removable prosthodontics have a removable partial denture, we mean cast partial denture. Very straightforward. Cast partial denture, that means it is something casting. After casting, the partial denture which comes out is called the cast partial denture. So this is an example of cast partial denture. No, it is not. So this has got clasp. These are the combination clasp. So this is just a treatment partial denture. Now what are the indications for removable partial dentures? So the length of the edentulous span that contraindicates the use of a fixed partial denture pretends a longer edentulous period. No abutment tooth position posterior to the edentulous space. That will again go for removable partial denture. Reduced periodontal support of the remaining teeth which is present. We cannot give fixed partial denture. There we have to go for removable partial denture. Need for cross arch stabilization. That time we have to go for removed partial dentures. Excessive bone loss of the residual ridge which is present. Then we have to again consider removable partial denture. The patients who are physically and emotionally not stable, they have to be given removable partial dentures. At times we are not supposed to give removable partial denture to mentally unsupported patients. Aesthetics of a primary concern in replacement of a multiple tooth in the anterior region, or need to replace teeth immediately after the extraction, we have to go for RPD. And if the patient's desire with the economic problem of the patient that no, he cannot pay for a fixed partial denture, we have to go for a removable partial dentures. Now when removable partial denture comes, now the space, the edentulous space which is present can be many, can be n number of spaces present. So for that there was a classification which came over. Kennedy himself gave a classification which was divided into 4 classes. Class 1, Class 2, Class 3 and Class 4. Class 1 says when posteriorly we have both the sides distal extension case. That means like this. It is tooth tissue supported on both the sides posteriorly. That means no teeth present in the last area. That type of intraoral condition will be called as Kennedy's class 1. Now what was Kennedy's class 2? If that kind of condition is not present bilaterally on both the side and present only on one side, that will be termed as class 2. That is unilateral edentulous area located posterior to the remaining natural teeth. Remaining natural teeth, unilateral edentulous area present, that time it will be called as class 2. Class 3 is when both the side it is supported by tooth. So class 3 is the only tooth supported removable partial denture. That is unilateral edentulous area with natural teeth. So class 3 is the only tooth supported where it is edentulous unilateral area with natural teeth both anterior and posterior to it. Anterior also and posterior also. Now this is tooth supported completely because the support on both the side we have two abutments. So that will take over the forces of the teeth. Class 4 was single bilateral edentulous area located anterior to the remaining natural teeth. Anteriorly present, and it is the midline was crossed in this case. Now class 3 and class 4 is similar. See, almost similar. Both are tooth supported. But what is the difference? The difference is class 3 is not where midline is crossed. It is unilateral. Whereas class 4 from the midline, both the side edentulous, so it is bilateral. And moreover, class 4 can be called as a tooth tissue supported. Because if it is a longer span, this is tooth tissue supported rather than just tooth supported removal partial denture. Dr. O.C. Applegate later attempted to expand the Kennedy system by two more addition, class 5 and class 6. Class 5 said that an edentulous area bounded anteriorly and posteriorly with natural teeth like in class 3, but in which the anterior abutment is not suitable for support. For example, a lateral incisor which is not suitable for support. So that will be considered in class 5 because that will be again a tooth tissue supported. Class 6 was said to be an edentulous situation in which the teeth adjacent to the space are capable of total support of the required prosthesis. A very short span fixed prosthodontics where it was only tooth supported. So that was again considered as class 6. Applegate in himself said and thought that just these 4 and 6 classifications were not going to solve a purpose. When as to make it a generalized classification which has to be followed all over the world, it has to even amplify some rules in that. What if ideally such kind of cases are not there? Ideally we can get these kind of cases. In patient to patient, the edentulous span may vary. So what about those cases? So Applegate gave his certain rules. 8 rules in order says that the first rule is the classification should follow rather than precede extraction. That means the classification of the removable partial dentures to be placed on edentulous mouth, a partially edentulous mouth is to be considered only after extraction of the teeth which we do not want. So the final area that we are seeing, then we have to go for classification. It is not before the extraction only we have to classify it. It is always after the extraction. Rule number 2 says if the third molar is missing and not to be replaced, it is not considered in the classification. For example, here if there would have been a third molar, I want to remove the third molar and I am not considering that. So that third molar will not be considered in removal partial denture. Rule number 3 says if third molar is present and is to be considered in the fabrication of removal partial denture, that has to be counted. That means if there would have been a third molar here and that you are supposed to use as an abutment teeth, you have to consider the third molar as one teeth. So this will convert into class 3. The rule number 4 says if second molar is missing and is not to be considered for replacement, do not include it in the classification. Similarly, the same goes. Rule 5 says the most posterior edentulous area will determine the classification. That means if I have a edentulous span here like this and these two molars were also missing, it was an edentulous over here also. So the thing which I need to consider is this side, because that is the most posteriorly missing area. So most posteriorly missing area will determine the classification of that particular partially edentulous mouth. So rule number 5 is clear. The most posterior edentulous area always determine the classification. Rule number 6 says edentulous area other than those which determine the classification are referred to as modification and are determined by the number. For example, here I told you like this is also missing, and if these two molars were missing, so this will become unilateral distal extension, that means class 2. And since there is another missing area over here, not the number of teeth, missing area over here, so this will be termed as modification, also written as mod, M-O-D. So this will become, if this molar was not there, class 2 mod 1. That is rule number 6. Coming to rule number 7, the extent of modification is not considered. Only the number of edentulous additional areas, that is, number of missing teeth is not considered for RPD. What is considered? The edentulous areas are considered. For example, if there here we know that one premolar and one molar is missing. So it doesn't become, if this was not there, it doesn't become class 2 mod 2. No, edentulous space is 1. So it becomes class 2 mod 1. Coming to the last rule, that is rule 8, there can be no modification for class 4. Why is that so? Now class 4 is what? That is the anteriorly bilateral edentulous area. Now if there would have been any modification, that means any other edentulous area behind this area, that would have been considered as classification. So that will not remain class 4 anymore. So that is the reason class 4 cannot have any modification. That is the rule number 8. These are the different rules given by Applegate, and that is how we classify and categorize the removable partial dentures. Thank you.